36 years ago, I got a phone call from my mother. My 19-year-old sister, Barbie, pictured here at the age of about 5 or 6, which is how I'll always remember her, was being admitted to the hospital. Several weeks later, Barbie was dead, having been misdiagnosed for 12 years of her life with epilepsy, when in fact she had a heart defect. 12 years of suffering with the wrong diagnosis, the wrong doctor, the wrong care, the wrong hospital. The loss of my sister was devastating to my family, as you might imagine. No parent should ever suffer the loss of a child. And it began me on a 36-year journey to find the information so that any mother, any parent, anyone here in this room, confronted with a medical problem, can find the right information so that when this happens, they can find the right doctor, get the right diagnosis, get the right care at the right hospital. You know, over the last 20 years, the internet has radically transformed our lives, but I think in one way in particular, what it's brought us is transparent access to tons of objective information so that when we make decisions, we can use informed decision-making using our brain in addition to our subjective and emotional decisions that use our heart. A couple of examples for you. Every month now, 130 million people go online shopping for their dream home. They can learn everything about that home. They can learn about the square footage, the layout, the schools, the neighborhood, video. They can learn everything they know without ever taking a visit. 46 million people every month go shopping for their dream car, and they can learn everything about that car, performance, quality, style, price, without ever taking it for a test drive. Even 40 million people a month go online looking for love. That's right. Looking for information so they might find the information that would help them be compatible with a mate before they take him or her for a test drive. So why is it in healthcare? Why is it when it comes to a matter that can be a matter of life and death, the choice of the right doctor at the right hospital when we're confronted with a medical condition, that the information is inaccessible? Why is it that it's opaque? So what do we do as consumers? We crowdsource names, that's right. We ask our doctor for a referral. He writes down several names on a piece of paper. What's in a name? We ask our friends and family, and they say, oh, we love Dr. Smith, we love Dr. Jones, but is that meaningful? We ask our insurance companies, and they tell us, well, if they're in the network and they're close by and we can get in, they must be good, right? It's ironic to me and frustrating that I know more information about the statistics and experience of Peyton Manning, a quarterback I might choose for my fantasy sports team, that is, if it's legal in this state, than I do about the doctor, the orthopedic surgeon who would operate on my knee. It's ironic and frustrating to me that I can know more about the 1, 3, and 5-year return on investment, the outcomes per se, of a mutual fund I buy on Fidelity.com than I do, again, about the quality of the physician who's going to operate me, or the orthopedic surgeon in this case. And it's ironic and frustrating to me that I can know more information about my prospective mate. I met my wife, Roberta, online at JDate, than I can about someone I'm going to have an intimate relationship with. That's right, intimate. The physician who's going to operate on my knee. So what do we do about this? Where do we start? How do we begin to deal with this? The first thing that I decided to do was to go ask physicians. I asked 400 physicians about how they refer patients to other doctors, because that's what they do most of the time. And here's what they told us. Contrary to what you would expect about like country club stereotypes and medical school relationship stereotypes, 65% of physicians are frustrated with the information they have to make objective and informed referrals. That's right, 65%. What they told us mattered most to them in making an informed referral, the information they'd like to have is the following. First and foremost, they want to know the concentration or subspecialty of that physician's practice. They want to know, secondly, the frequency or volume with which that doctor diagnoses or treats problems, his experience. They want to know the quality of the hospital at which they practice. They want to know whether they can get the patient in, that's availability. And they want to know if other patients are going to like them, because they don't want the physician to have blowback because they referred them to the wrong doctor. Let's start with patient satisfaction. Now, patient satisfaction matters a lot. Wouldn't it be great if, just like Amazon, when we buy a book or we buy a movie or a refrigerator, 5 stars told us everything we want to know? Just 5 stars, right? Be great. But I looked at 6 million patient satisfaction records, and what we saw was the inverse of a bell curve, we saw an inverted curve. In fact, what it means is that more than 75% of people seem to be happy with their doctors and their care, and less than 20% of people were unhappy with their care. It doesn't mean that patient satisfaction doesn't matter. It just says maybe there's more to it than that. Let's begin with where physicians begin. Physicians begin with experience. Most of us as consumers can't differentiate between orthopedic surgeons. We don't realize that the right doctor for our knee isn't the right doctor for our hip, isn't the right doctor for our spine. That's right. But what physicians tell us is concentration. The pie charts I show here, that really matters. Why? Because having looked at more than 2 billion medical claims, 2 billion, what I realized was that 15% of physicians account for the vast majority of all diagnoses or all procedures that are done. 15%. Wow. And why is that important? Because clinical study after clinical study shows us the more frequently a doctor diagnoses or treats a problem, the better the outcomes, the more likelihood that you're going to live or not have a complication. Quality matters too. The quality of the hospital at which you have a surgery done or you're treated has a huge impact on your outcome. Well, what do we mean by that? Your likelihood of living or dying or having a complication like an infection. Here in Colorado alone, your chances of dying from common procedures like prostate surgery, COPD, or heart failure are between 7 and 9 times greater at the worst performing versus best performing hospital. So quality, experience, and satisfaction all matter to us in making informed decisions about physicians and hospitals. So as consumers, would that make a difference? I wanted to know if we gave this information to consumers, would it change their behavior? So we asked 1,000 patients who had recently chosen a new doctor to participate in research. And what the data showed us was that when they were given access to heretofore unavailable information like experience data, like quality, like satisfaction data, what happened? They were twice as likely to prefer those physicians. Now that didn't tell us they could choose the right doctor, so we did one more piece of research, just one more. And what we did was we allowed consumers to choose from amongst 3 doctors with no education about this information, and yet 56% of consumers chose the right doctor when given a referral. 56%, not bad. But when we gave consumers the same information I'm giving you today, just that, 95% of consumers, given several doctors to choose from in a particular diagnosis, were able to find the right doctor every time. Wow. We live in a transparent world where we're used to now having access to information, objective information about virtually everything, except in healthcare. But when we have access to information about satisfaction, experience, and quality, we're able to make more informed decisions. Let me show you how this information could work in action. This is my mother. This is Mom. Mom turns 90 literally this weekend, and I'm leaving here to go to her birthday party, her 90th birthday. Now, 36 years ago, I couldn't help Mom get the right doctor and the right care for my sister. But today, I can show Mom the following. Mom's had 2 hip surgeries, and some days she might need a third. So I can tell her this, Mom, in your area, there are 341 orthopedic surgeons to choose from, 341. But of those, only 150, less than half, have performed a hip replacement in the last year. But of those, only 20, less than 6%, only 20 are the most experienced in performing hip replacements in your area. And of those, only 2 of the 341 practice at a hospital with the lowest complication rate for hip replacements in your area. And of those, only 1 is more satisfied by patients than the other. Only 1. So what does it all mean? When consumers have access to experience, quality, and satisfaction data, objective data, they can make informed decisions and get to the one right doctor at the right hospital and get the right care. So what can you do about this? What I would ask you to take from this talk today would be the following. Listen to what the doctors told me. Go ask questions, go do your research on the internet, but when you do, ask these questions. Ask about the physician's experience, the concentration of their practice, the subspecialty. Ask about the frequency which they've seen this problem and have they dealt with it before. Ask about if you're going to have a surgery, the mortality rate, the likelihood of living or dying at the hospital you're going to, and complication rates. And surely ask others about how satisfied they were with their experience with that doctor. Ask all those questions. I truly believe that transparent access to information is transformative. It can change the entire healthcare system. It changes the whole way things work. And let me tell you why. When consumers have access to information about objective information about experience, quality, and satisfaction, here's what happens. It saves time because we can navigate the system so much faster, no wasted time. We can save money because in healthcare, quality always costs less. Fewer complication rates, shorter lengths of stay saves us money. But most importantly, when we have transparent access to information to make informed decisions, it can save a life. I hope someday it saves your life. Thank you very much.